Welcome to the Brain Body Fit podcast. I'm Dr. Jerome Rerucha, and I'm here to help you cut through the noise of fads and quick fixes and focus on proven strategies for optimizing your health and peak performance. Join me as we explore regeneration, anti-aging breakthroughs, nutrition, and the power of improving your physical and mental strength to unlock your brain and body's full potential. Hey everybody, Dr. Jerome here today. We got a really great show here where I have Dr. Joe Schneider. He's a very advanced chiropractor in Pennsylvania. He's just one of the great people I've met over the decades of me getting to lecture and meet a lot of great people. Ultimately, we're going to get into talking in depth about the vestibular system. Dr. Schneider's great at a lot of things, but we could call him Dr. Vestibular almost, as he will explain that and how it really pertains into his very advanced practice. But Dr. Joe, welcome.
Thank you. Welcome. I'm so glad to be here. I feel like I'm synergistic with you in our approaches and our desire to kind of define the way the human body functions and how to optimize function in almost every patient that comes see us, right? So if you know what optimal function is, you're going to know what it's not. So knowing normal gets you there. But when I started out as a chiropractor, I had been an engineer and I had back pain. And my mother had gone to a chiropractor. I knew nothing about it. And so, I go to an orthopedist, they give me drugs, didn't work, kind of get worse over time, stretch, do this, do that. And then my mother said, go to this chiropractor. And I went to Dr. Bill Oliver in Riverton. And he took a full spine x-ray and, put all the lines on it, where all the faults were and things like that. And I was like, man, this is fascinating. Like, I have all these things going on with me. And man, I saw my shoulders, my head was tilted. I had an A to P open mouth, the whole thing. And so from head to toe, he evaluated my system and he started talking about that the spine was the master control system, like the brain, and the master control system. And I was doing simulators for power plants, and I was like, that seems about right. The brain and body is this master control system, this intricate control system. And it really started to fascinate me. So, I really kind of got into the proprioceptive, the strength of systems and the strength of the nervous system, circulation, things like that were all controlled from the brain. And so from there, I started the neuro program and I started getting into vision, to auditory aspects of it. And I started doing work with the vestibular system as far as people coming in having dizziness. Dizziness and vertigo were really big at the time, especially after auto accidents. I get a lot of auto accident cases. And, I wasn't really like an auto mill. I was kind of like, you came to me, I want to get you better. I didn't care about the case really. I just want to, concentrate on what is going to make you better. And as I was going through, I started doing a lot of testing. I did JTEC testing, isometric testing, and then I did some EMG, NCV, SSEP. I was getting into on that, and I was doing visual evoked potentials, and I was doing auditory evoked potentials, and then I was doing isokinetic testing for the neck and the low back. And I was like really learning a lot, doing functional things. And then I would do calorics in the ear. I watched my patient throw up, and I think that I learned more from making mistakes than I learned from doing it right. So, I really started to see that this body was more intricate than I ever thought it was going to be. And you have to look at sometimes technology and how technology can help you understand the function of the body. So that's where I came from. And then after I had a stroke, I got a gyrostim. And
Now, how
then I
long ago
really
was your
started working
stroke
with it.
already, to give people just a little bit of an idea?
Well, I had an auto accident in 2004, hit the windshield. So I got traumatic brain injury, and I became dysautonomic after that. That means my blood pressure went up. When I stood up and I was working, my blood pressure was perfect. When I sat down, my blood pressure went up, my heart rate went up. and, and I couldn't understand that. I was like, well, that's not the way it should be. It should be the opposite way around. And so, I mean, I had to do a lot of rehab in 2004. And then I felt like I had got it under control. And then I had a rear end accident with a drunk driver. He hit me in the rear, took off, and I really started getting really, really bad. And I went to see a doctor in New Jersey who was helping me. But when I got on the elevator to leave, and the elevator was going down, I fell on the floor and I felt like I was a beach whale. I mean, I couldn't get up. I was so dizzy and nauseated and things like that. So, when you say I'm Dr. Vestibular, well, a lot of chiropractors have a story, a backstory about trauma and kind of going to a chiropractor and getting their lives back and able to go to school again and then study to be a doctor of chiropractic. They get that passion for it because of life interferes with normalcy. So you had to be abnormal to start to be a chiropractor. No, that's not totally true, but that's what happens.
Well, there's a lot of great stories, and that's why, with their people's personal beliefs and what they overcame, of why they're so passionate, bringing it to other people. And those backstories are really, really powerful when people do have their own personal overcoming.
Yeah, and it gets them to want to find answers of where they were and how they got better, and then share those answers with their patient base. So through my unfortunate circumstances with trauma and auto accidents, it brought me to a point in which I had an aneurysm from the initial auto accident, and it popped in 2017, and I had a hemorrhage in my left basal ganglion. So I tell my patients I'm Parkinson's by stroke because I lost a good bit of my basal ganglion on my left. And then through all that experience, I had a near-death experience, and then a lot of things happened, and I was at a point where I was ready to give up. I was totally bankrupt. Lost two brain imbalance centers. I had my own practice, and I was doing very well. But then after that, I wasn't. It just happened like that. You're doing great, and then all of a sudden you're not. And thank God for my wife who supported me, never left me. I was like, why don't you just leave me? It's not good. It's not good. And so we developed the center, and then she basically laid down the law and said, "You're not buying anything else." I said, "Okay, I got enough. I'm not buying anything else." And then she would come to me and said, "I just saw this, and I think it'll help you out." And so then she'd buy it, and then I had more technology, more equipment. And I'm not saying that I knew exactly how the technology was going to be applied within our system and also within the patient base. But we soon found out that using great technology to assess function creates, like you always talked about for concussion cases, the baseline. What's the baseline? And they would send people for impact testing, and that was supposed to be the baseline. But it was very simple and inefficient baseline to put patients on. So I think the first thing that we wanted to do was develop the diagnostics to get a baseline, a full baseline that would assess all different parts of the nervous system. And I know that you're into baseline and testing and so forth, and you develop your own system for optimizing your patients. But we wanted to really kind of get into a full neurological diagnostic. So we do balance testing, which is really important. We do visual testing. We do 2 types of QEEGs. We do a vital scan where we look at blood pressure, oxygen, heart rate, standing, sitting, deep breathing, and things like that. We don't do the tilt test. I tried the tilt test. People are very uncomfortable with tilt. So doing the vital scan without tilt is about the same information that you would get. So we would do that. Then we do pseudomotor testing, which is basically a BIA of the hands and feet. And it gives a lot of information about hydration, body fat, and peripheral nerve function. And then we do a Krios test for cognitive function. And so we just get a lot of information on people. And we found that it's not too confusing for the patient. They relate to it. And they basically will say, like, our cases are bad. They're like, really, these people have lost their life. They can't really get out of bed. They have a hard time moving, hard time everything. And they relate to the answers that they get on the diagnostics. So you don't have to get really into a complicated explanation. You just have to show them some simple facts about what's going on. And they're like, well, that definitely defines me. That kind of defines like where I am, where I'm functioning. Why that when I get segmented care, I tried this, I tried that, I tried this, and I've been to about 20 doctors, and I'm not getting anywhere. And so why didn't anybody else do that? If I go to my medical physician, why do they keep giving me more medications and I don't feel any better? And they may have like 8 medications. We have a woman now that has 8 medications that she just started this week. Feeling sick, digestive problems, nausea, dizziness, the whole gamut of dysautonomia. And I think we're going to get her better in 10 to 12 weeks, where her life impact is profound. Now, I think that we do things for a profound life impact. I love chiropractic, and I think adjusting is important for the spine. But I got to the point where I didn't just want to keep adjusting and adjusting and adjusting. I wanted to adjust, strengthen the system, and then feel good that maybe I don't have to see this patient anymore. I can just kind of release them. And then if they have good life, good health, good exercise, right, which is very, very important, then things are going to turn around for them. And it seems to be working. All right. It was kind of, I rolled the dice, took the gamble, put it all in, and it's working. So now we're at a point now where I used to spin people in chairs. Okay. Now I have a chair spinner, right? Thank God for Dr. Jerome, right?
Well, you had some spinners before that, even though we share, significant philosophy, kind of have different types of patients, definitely, but that whole thing of strengthening the system, empowering people, taking very complicated cases, neurological cases, metabolic cases, and not just giving them hope, which of course that's part of it, but really looking at that broad spectrum to where chaos can make sense to them, and it's very empowering to them. And also to teach people how to take as good a care of themselves, that there's definitely things they're not going to be able to do for themselves when they come to you or me and those types of things. And that's our passion and job in the beginning. But yeah, we're going to get into some pretty fascinating things here because your clinic and methods are so dynamic. So you mentioned some of the things that you do within your exam, and that's going to build into it for what we are going. But even now, why don't you mention to people, because you're going to throw a lot of information, even different products that you have, and we're going to get into the vestibular spinners that we do share. But what is your website, if you can mention that now?
Yeah, it's hopebraincenter.com. HOPEBRAINCENTER.com.
Because you have a really good website and the different things you're going to go through. I know people, if they're not able to take notes right now, if they're listening to this driving or whatever they're doing, they're going to be really interested in that. But your website is really good, that goes over what you offer for people and the basic function of it. So as we're going to get into the vestibular system here soon, and we could do that now, why don't you start mentioning some of the things that you had and how you used it before you got into the Bronson balance spinners, because you were very advanced and kind of some dream case scenarios you have at your clinic.
So when you do balance testing, you want to look at head and neck movement, eyes open, eyes closed, right? So we use a CAP system by Vestibular Therapeutics, and it's a pretty accurate system. It's been, for me, state of the art for many, many years. It's a triangular plate, and then we measure, and then you put a pillow plate to make it more difficult. And then we get 4 different types of scenarios. We'll get the hard plate, like you're standing on the ground, very stable. Eyes open, head right, head left, looking up, looking down, right? And before people get on it, they'll tell you, well, if I do this, then I'm going to fall over, right? Then you do it with their eyes closed. Then you put the billow plate on, and the same thing, eyes open, then eyes closed. And then that kind of really defines their dizziness, okay? And what type of head positions are the worst for them. Now, head position is really, really important because I find that the upper part of the neck and the muscle systems are like your own little gyro, right? It's like, head tilt like that is the posterior canals, right, in the back, and it is a torsional movement of the eyes, right? So the vestibular system and the canals, the semicircular canals, they talk about the canals, and the crystals are malaligned or loose or something like that, and you get that type of movement. And then you have anterior canals, so that when you look up and look down, your neck is extending and flexing, right? Then you have the horizontal canals, so that when you rotate, head rotation left and right, you get that. So you're really looking at canal activity and reciprocal activity of the upper cervical musculature, like the rectus capitis, posterior minor, posterior major, obliquus capitis, superior, inferior, things like that. And they are the things that we look at and we take seriously. So that's good information. And then when we have the new goggle that we use is called the DX200. It's by Neuroline. And I've been using that for a long time. I use the DX100. And then this is the next evolution of that. And you look at different eye movements, like targeting, and look there, look there, look there, look there, looking back and forth. And that's called a saccade. And then you look at smooth pursuit movements, right? Horizontal and vertical, right? Can they pursue? And so most people that have brain injuries, they can't do any of that. And it's really pretty dramatic, like when you see that. And then the other one is convergence, right? Where they follow a point in, the eyes come in together, and then diverge, converge, and diverge. And then you have a combination where you get constriction of the pupils. So the eyes have a lot of different functions, but they are related in a sense to the vestibular system because the eyes can move, right? Small movements called nystagmus. It's a slow, fast movement. Nystagmus can be normal, but it can be abnormal too. So by that, we're really starting to look at like cortical controls, subcortical controls, brainstem controls, and how that affects your body posturally and affects your digestive tract, causing nausea at times, right? Anxiety can be related to that. So there's a lot of overlap in the vestibular system through the middle of the brainstem called the pons. It's pontine. And it's also related to the locus coeruleus, which is in the pons also, which will upregulate your sympathetic system for heart rate. Okay? So everybody who's been on a roller coaster and gets off and throws up then understands how the vestibular system can impact them, right? But in athletic pursuits, right, there's like turning and moving in different directions like this. And you're really assessing you're really like putting demands on the vestibular inputs to help you to move gracefully in space. And when you don't move gracefully in space, then you get dizzy, you fall down, you get syncope, you get nausea, anxiety, panic attacks. There's a whole rate of symptomatology that is overlapped with so many different systems that you start to say, well, wow. I better take a look at this because that overlap is pretty dynamic. And so, that's kind of like what we're doing now. So we got a gyrostim, and the gyrostim interests me because my aunt had cerebral palsy for 78 years. She was in a wheelchair, couldn't move her arms or legs, and in a wheelchair from birth, the most pleasant, lovable person you could ever meet. And so I had the fortune of, with my mother, taking care of her a lot. And my mother was kind of like this engineer, like, how can we change the wheelchair to help her out? Where can we position? How can we support her spine? And all these different things. And so my mother was kind of like, she always asking questions and always trying to find solutions. And I think I got some of her personality over all these years with her. But so the gyrostim was made for the designer, Kevin. His daughter had cerebral palsy. And when I first saw the gyrostim back in 2009, I was watching the videos of him with his daughter in the gyrostim, the first evolution of the gyrostim at the time. And that really fascinated me, that could you rehabilitate someone with cerebral palsy and affect their posture, their head position? You could get their extremities starting to move, right? By spinning. And he started her in a car seat with wooden circles, and he was flipping her over in the car seat, right? So I just kind of imagined him in the park flipping his daughter in a car seat, and all the parents going crazy, like, what is this guy doing there? But I lost contact with him for years, and then when I wanted to get a gyrostim in 2018, I went to his website and I saw a beautiful young lady around college age with the laser in her hand, hitting targets, moving her head, sitting up straight. And I called him up and I said, Kevin, is that your daughter? He goes, yes, it is. And she's been doing gyrostim all these years, and she went to college for neuroscience. And she doesn't really walk as well as I'd like, but she uses her upper extremities perfectly. And it was the gyrostim, so that did that. So that those life experiences, like we were saying, are impactful. And then I said, okay, all right, when we get in Justin, well, $220,000 later, it was like, okay, it's in the office, and my wife's going to say, like, how do we pay this back? But it's been quite I would say, a very definitive technology for our patients. Now, the gyrostim is not as precise as the other things that we have, but you get a laser in your hand and you can change hands and hit targets. Boom, boom, as you're spinning and moving around, right?
And it's very three-dimensional spinning. So, just for people listening to this, obviously go to Gyrostim website, you'll see it, or go to Dr. Joe's website and you'll see it. But basically, it's kind of what you would expect somebody in NASA to have, because it's a very three-dimensional spin. It can turn you upside down. It can really tumble you. But there's different programs. There's different RPMs. Obviously, you can go turtle slow in it. But you could really max it out. If you're a super elite athlete, it would take a while to get used to.
Yeah, 30 rotations a minute. When you're watching it, it's like it just blows your mind.
So it's a big, impressive piece of machinery. Some people don't even have rooms that this thing would fit in is treatment rooms. But again, it serves a very significant purpose. And that's probably the most significant vestibular machine out there, and I don't have one of those. But understanding the importance of the vestibular system, and from day one teaching seminars, we were spinning people in chairs, again trying to affect them. That was 26 years ago, especially with lasers. Drive the pathway, find those imbalances, laser people, adjust them, and again seeing profound changes based upon not even having all the technology to be able to map it out, but function. So it is just so great to see how you have moved with the cutting edge technologies for diagnostics as well as treatment. And
dual tasking, right? I know you know what the Stroop test is, right? Well, there's 4 targets, right? 2 are red and 2 are blue. The blue targets are 5 and 6. The red targets are 3 and 4. So each target has a choice. It's odd or even, red or blue, and 3, 4, 5, or 6, right? So you can do a cognitive sequence with the patients. So we do a lot of sequencing, especially for memory. So if we go back and we do a tachyscope on our neurosensory boards, they'll get 3 words, they have to memorize them, and then they go in different directions, and they have to hit them in that order. Simple thing, but patients get challenged by it, right? So we can do like a 4 sequence on gyrostim. So if I can do a 4 sequence with a patient on tachyscope, then we spin them with the targets, right? And at different speeds, people can do it in different speeds, and we're going to say hit a blue, hit a red, even odd, right? But it's a simple sequence right there. And they'll be non-symptomatic at the speed that we're running them in. Then we add a sequence, and they'll get nausea, they'll get headache, they'll get brain fog. And it's like, all right, so why did that happen? And then you start to realize that the vestibular system is related to much more than dizziness. It's related to all the other symptomatology that goes along with it, right? And then the other thing is that you're exercising the visual system. Look at a target, get another target, right? And that's the saccade, right? Or as you're going around with the target, you're following it, and that's pursuit. So it's like a pursuit saccade type of combinations that you see. The other thing that we see a lot of is tremor. So when they're on the gyrostim, they have the laser, and if they're tremoring, right, they're around the target. They can't kind of get the target. But then as we practice doing these routines, not only the cognitive routine, because then the tremors get worse with cognitive, then they start to see that, oh, I'm not bouncing around the target. I call it being demonstrative. They're like boom and boom and boom. It's not like like that, right? So it can exercise basal ganglionic type of aspects to it, and then when they get off, their gait's better, so their gait works better. So the gyrostim's been a lot of fun. Women are the most aggressive gyrostim participants that you could ever imagine. They're like, how many did I hit? Like, can we go faster? Can I hit more? But then,
Can I come back tomorrow?
yeah, exactly. Do you find that in your practice?
Yeah, I mean, I don't have a gyro stim. And, also we're when people are not so inhibited as a lot of people that you do, like we do, we get them up and move, so, so a lot of people are like, oh my gosh, I'm tired today. I'm done. I've had enough. So we don't have people like at a carnival want to get back in the line. They're like, okay, I need to recover. Come back in 2 days from now. And so many people, when they go to a clinician, it's passive, but it's that neuromechanobiology that's such a big deal. Adjusting's a big deal. But when we're looking at strength of the organism and just general physical preparedness, general neurological preparedness, and when you really start looking into the nervous system, the neuromusculoskeletal system, posture, however you want to look at it, as soon as you make your way to the vestibular system, it is a super system, to say the least. I mean, everybody in academics, you're taught the integument system, the endocrine system, the nervous system, the muscular system, the skeletal system, the digestive system. And obviously the vestibular system is a part of the nervous system, but its far-reaching effect of what you said before is so profound. I know, especially in chiropractic, people are very aware of the importance of the vestibular system. It was talked about a lot when I just became licensed in 2000. And like I said, just introducing lasers to the world, it really opened up a whole nother level what you could do with the vestibular system, not just driving pathways, whether they were very fragile people, or again, I came from the athlete world at that time and had experience, training gymnasts and, super basketball players going to the NBA, even though I was at the college level. You were working with a lot of 4 or 5 star athletes, and your job was to make the 2 and 3 star athletes as good as possible. So I just loved it, so it was a different perspective on neuromechanobiology, but very applicable as you get into a practitioner. And I think incredibly valuable to, again, what's normal at different levels and thresholds is very different than just on an academic textbook clinical side of things. But the vestibular system is one of those shared things, whether you're looking at it purely from a clinical standpoint and the importance of very injured people, or you're trying to max out the potential of the person. And that's even with your executive functioning and brain speed versus just physical output. It is profound. So for so many years that I've always shared this too, I've always kind of taken a little different perspective. I always look at, hey, what makes a super athlete and how can I scale it down so much that it's very applicable to anybody who comes into my clinic. And in some cases, you're pushed in a wheelchair. So I always knew, even when we were teaching seminars 26 years ago, and we're spinning people in chairs and knowing there was the big NASA spinners out there at 2000, and gyrostim came after that, but that just wasn't practical, financial wise or even space wise in a clinic. So I always looked at it and I always knew there was a gap between so many other things that we do that really bridges together on a scaled level of this is what the elite of the elite do, but we scale it so far down to patients. It's like it's pretty easy to get you asymptomatic, but whatever your goals are, we could take you there. So when I saw Bronson Balance then, and ultimately how that stemmed from the figure skating and working at people at the most introductory, like first day they put the skates on. And I love youth athletics, especially how you're developing the nervous system and lessons of life and all those things. So it was just a fascinating tool to me, and it was that bridge I was really looking for. especially to share with a large audience too, we always want people to know, it's like, hey, who's the best of the best dealing with the vestibular system? And I'm like, well, I got Dr. Joe Schneider, who kind of sets the standard with that. But for everybody else, it's like you don't have to jump to what you did. And so Bronson Balance, these spinners, they had so immediately, no one's going to do what a figure skater does. I mean, talk about a bionic nervous system, what they can do on there. And there'd be some people that, do really high cliff diving that would have, superhuman. You get into the martial arts, there's some pretty fascinating people. Gymnasts are always great. But there's a lot of people that aren't using these spinners yet in athletics, and the change in the clinic. So not everybody is comfortable truly working people out like I do. And this is something that you can do real passive positions. And we work on people with strokes that they can make it to our clinic, but you help them in the Bronson chair. And the neuromechanobiology, there's absolutely nothing you could do that put them in there to safely and effectively start getting that body to move and fire in ways that they aren't capable of doing. And the changes are profound.
Well, they are. Now, I thought that I would use a spinner because people didn't get as reactive on a spinner. Then I would put them in gyrostim, they'd be more comfortable.
Well, I don't want to jump too far ahead just because, like I said, all the gyrostim, but this is a neat, I want people to know what was kind of neat for me is I met you, like 10 years ago for sure. We've always kind of kept in contact through this. So, knowing how advanced you were and what I saw these spinners, I was like, wow, the vestibular system is such a big deal in chiropractic, and especially to the laser practitioners out there, this is going to be an amazing adjunct. And I kind of had in the list in the back of my mind from all the people I met over the years in my email list. It's like, wow, wouldn't it be great if, some of these people, and I don't ever want to be a hard salesperson, but you were like one of the first people, knowing how advanced your clinic was, that you bought a Bronson chair spinner and a Bronson balance bar spinner. And, but I loved the fact, so it was kind of curious to me. It's like, wow, how's Dr. Joe buying these when you have these? You came at it from the most advanced applications into dealing with vestibular diagnostics, having the gyrostim, but still seeing a need. So I don't want to jump to that yet, but I like this story where you're coming at it from your perspective and how advanced your clinic was, and still how we're going to get to that point.
Yeah, how can I, like I was saying, well, how do I fit this in? You know what I mean? But we don't therapeutically work with people in the standing position. They're sitting in the gyrostim, right? And that brings upon a whole different aspect of balance training. So the standing spinner, the balance bar spinner, is pretty quite valuable in advancing people, because gyrostim's not real world, okay? It's a good trainer, but it's not real world. But a standing spinner is real world, okay? Because people are moving in space and they have to rotate in space. So it's a very practical trainer, and it only takes a few minutes to apply it. And then we have the sitting one also, but people get more reactivity on the sitting spinner than they even do on the gyrostim spinning. And I don't know why yet.
That is interesting because, like I said, I couldn't even have that experience because I don't have a gyrostim, even though I spin a lot of people in a chair. And, one thing we talk about, because even in a gyrostim, you sit in an egg inside this big frame, basically. So you're strapped into a chair because it can be three-dimensional, even if you're not tumbling in it. But for instance, some of these basic exercises, of like band extensions that we do, and, head weighting. So some of those things you can't even do in a gyrostim, but it's a whole machine in itself, and it's fascinating. I would wish everybody had one, including myself. But one of the things I liked about Bronson as well is cost effective, relatively small space, but there was a tremendous amount, like pretty much all of the very introductory, what I call the brain body fit clinical exercises that we do: grip training, dexterity balls, head weighting, rubber band extensions, lots of different variations of rubber band extensions, bands around the knees. You could do all those things even for people sitting in a chair, and then obviously, again, graduating the ones that have to start in the chair into the balance bar as well. And so it was, you have this three-dimensional space. Obviously, you're not tumbling, but I mean, there's literally hundreds of different things you can do for dual tasking. And make no mistake, just the general spinning, whether you're just sitting there doing nothing else or you're just standing there doing nothing else, but the dual tasks and the triple tasks and the sequencing, and it's just, your mind is the only thing that limits what you can do.
Yeah,
but the neat part is it's really unlimited what you can do, but it's also, when you look at the roadmap that you've set, and I would love people to be even more familiar with what you do. We talked about having a seminar at your facility sometime. I know it's not going to work out this year, but I would really love to do that. Just because it's so unique, there is no way we could ever recreate in a hotel what would be in your clinic, really taking people from a diagnostic standpoint that's reproducible. And I love the manual diagnostic tests to where, you're not using technology and it's the skill and the art of the practitioner. But some of it, when people just aren't that advanced and they can't see the saccadic eye movements and they can't see some of the subtleties, obviously they could see a lot of the major things and learn step by step. But when you can get the subtle data that you have with your technology, make changes with lasers, activating with pathways, vestibular spinning, the adjusting, and then retest people, it's really profound. Of course, symptoms change, people's function in daily life changes, but to also calculate that data is just more and more reinforcement for people in our profession of how powerful it is what we do, even when you don't have all these tools. But I'm also a big believer these tools and evaluation devices help us become better, because not only we're evaluating the patient, we're also evaluating ourselves. And that's a kind of a big part of Brain Body Fit is the 3D exams that we do. And it's unlimited. It's just the concept, and I want people to really put their passions together. But you're not just examining and correcting the patient, you're also examining yourself from a very open-minded perspective, I'll put it that way.
Yeah. Well, that 3D perspective, right? We live in a three-dimensional world, right? And so what are the faculties that we need to really navigate that three-dimensional world? And you said, there's different level of athlete and there's different level of requirements for it. But even a person that's in good health has to have a good visual system, good auditory reactions, good proprioception, and good vestibular function to navigate within that three-dimensional world. And it's like, thank God for chiropractic, because, we stayed true to what we're doing, and we saw how the body reacts to the three-dimensional world, first by posture, which is a reflection of core. So we find that the more we work a brain with a person that's really sick, the faster their spine becomes more aligned, more mechanical, stronger, and so forth. So that's kind of another aspect of it.
Yeah, and even with all the diagnostics, to your point, even just when I spin people, and it's very controlled spinning, you can see what's the percentage of RPMs that you're doing, and even kind of testing people, what their function, what their tolerances is. We could even measure visceral reflexes. You can measure heart rate. You could, live and when they're doing these things, you can see that sympathetic, parasympathetic response, whether it's through respiration, it's through heart rate, it's through variable heart rates, even on different sides of the body. And you get to see, even if they don't have the butterflies in their stomach. And our goal is not to make people nauseous when they do that. We stair step them slowly. but we film people a lot doing this. We record
I've been accused
their
of that.
performance levels, and it is remarkable how fast people improve, even our stroke victims of capabilities who, they're walking trash cans, they eat terrible, and, now they're neurologically severely inhibited. And as much as we want them to be three-dimensional, there's just some of those people that come to us, they never make the metabolic changes that we require for our average patient. But it is also profound to see the changes that spinning, adjusting, laser therapy in that combination, how they work. And spinning is a standalone. I mean, when you look at the super athletes and how it raises thresholds, and one thing that I've really noticed since implementing Bronson regularly and training on it more regular, like I feel not only in my patients, but myself, I learn faster now. Anything I do, whether it's physical or it's mental, the body responds faster. And it's all based on the percentage of how fast can you spin, where it was a challenge for you before, and now it's like pretty insignificant, so I'm doing a lot of work spinning, without the balance bar, and, eyes open, eyes closed, different body positions, using dual task applications, doing figure eights with medicine balls and different things around you, and using water resistance, not metal kettlebells and things like that. But we have like water instability training we implement with it. And it is a super system. It's just the variation of things that change. And of course, how we just stair step that into our patients.
Yeah. Yeah, the more that you work within systems like this, especially vestibular, the more your eyes are wide open to what the reality is of function, and you witness it, like you say, improving cognition, better behavior. Especially with the kids. The kids to come in, they have severe ADHD, oppositional behaviors, and things like that, and then 12 to 16 weeks later, they're really cooperating. They're doing better in school. What did one mother say today? My son always looked like he was a deer in headlights, and I got a call from the teacher, and she says he's not a deer in headlights anymore. He's answering questions. He's participating. He's really coming out of himself, right? And that's not why they came. Why is that happening, right?
But it is that mechanical, that neuromechanical biology, that rhythm of spinning. You realize, so for years when I lectured, and as a strength athlete, not even looking in PubMed, like everybody knows, if you're really serious about strength, grip is the last thing to go. And then as I wanted to communicate with doctors better, it's like, look, this isn't just for meatheads. Like, there's health benefits to this, even if you look at the Merrick chart with chiropractic. And, you can make the argument that you're not measuring the muscles of the hand, you're measuring the strength of the nerves that go to the hand, which for sure is C5 through T1, the brachial plexus. But then, of course, you look at upper motor neurons and how that affects even more systemically. And then, of course, tie it into the Merrick chart of how it affects organs. And so that's always a big part. We have a very big metabolic part of our practice, a lot of nutrition, a lot of functional lab testing. Food's always a big deal. We have bookshelves of supplements, but food we pound into our client's head. And so seeing these types of things, but how you can drive all of that, like your metabolism will improve the stronger your vestibular system is. Your brain improves the stronger your vestibular system is. And your heart, your cardiovascular system. And when you just search in PubMed, if you just search vestibular system and cardiovascular, vestibular system and concussion, vestibular system and anxiety, vestibular system and depression. Yeah. Of course, most people, they kind of look at it, and it's important. I know as seniors, as people get older, falls is a concern, but that's really just scratching the surface. I mean, these tools are very practical for home use. Of course, clinicians can be so incredibly dynamic with whether you're using a chair, you're using the balance bar, you're using more advanced applications of yours that have diagnostics and spinning abilities in them. But I cannot overemphasize the importance of the vestibular system, and no matter to what capacity people are doing it, even doing some of the textbook things, finger to nose, those exams that are in there, I don't want anybody to stop doing it. But I'm a big person. I got to challenge my patients beyond their comfort zone. And I would hope, doctors, through your experience coming at it from your way, my way, I'm coming at it from a different perspective that motivated me to come here as well. But when you can activate the body, and I would never say just one thing, is the best thing over anything, but it has been profound what doing controlled spinning in the clinic has provided.
Yeah.
And you've done it much.
I mean, I get it. And I got the spinners from you because I know you're such a great practitioner. And I just wanted to experience them, see what they could do, see how they should be in the system. And I'm convinced that every doctor or chiropractor should have a spinner in their office. Everyone, right? And I think that they would be excited by the response that they would get from their patient base, especially with dizziness. You start off doing 1 foot balance, right? Looking at person's gait. Is it a wide gait? Having them turn their head side to side, doing cross crawl type exercises. They're all valuable, but when you add a spinner, it becomes a deeper, more profound rehabilitation with it. And like you said, you can do multimodal type stimulation by, doing a medicine ball, working with a medicine ball and doing stretch bands and things like that.
This episode is brought to you by Bronson Balance Spinners. For a decade, the world's skaters have relied on an advantage to build extraordinary balance, coordination, and neurological control with incredible speed and precision. The Bronson Balance revolutionary models and training system have shaped athletes who perform at peak of human performance and movement, stepping onto the global stage with nervous systems developed beyond what conventional training ever dreamed possible. Now, for the first time, Bronson Balance technology is available in models suitable for clinical applications. The Bronson Balance chair, Bronson Balance bar, and Bronson Balance sports spinner bring world-class neural training experience to your practice. As advanced practitioners, the brain and body do not function separately. Movement and balance are neurological. Pain perception and autonomic system response are neurological. Health and performance outcomes are neurological with whole system effects. Yet most rehabilitation and clinical approaches target only isolated muscles, joints, tissues, or symptoms. Neurological rehab in particular rarely moves beyond low-threshold, symptom-based activation, leaving the master control system largely unchallenged in any meaningful way. The vestibular system is the master integrator of the entire brain-body connection, determining life outcomes. Bronson Balance Spinners provide a safe, precise way to stimulate the master neurological system in patients of any ability level. They activate key primary pathways that directly impact the full spectrum of human function, including eye tracking, balance, pain processing, cardiovascular response, and mental emotional regulation. This isn't passive therapy. This is brain-body nervous system training. Used alone, Bronson Balance Spinners offers a profound advantage in your clinic. However, Bronson Balance models truly shine when integrated with your existing clinical methods, including Erchonia high-energy non-thermal laser therapy, rehabilitation exercises, resistance training, visual drills, brain games, vibration, dual-task neuroadaptive strategies, and all regenerative cell therapy protocols. When combined, the clinical possibilities and outcomes expand exponentially. Visit performancepractic.com/spinners to learn more or purchase today. Bronson Balance spinner models are the new frontier of neuroadaptive clinical performance. We are no longer treating the symptom. Brain Body Fit and Bronson Balance is evolving the entire system, beyond activation into optimized neuroadaptation.
So, I think that chiropractors would really, really find that they would get a lot out of it. So it's, and then also, with vestibular functionality and neck movement, chiropractors are like notorious for really saying, upper cervical techniques and neck movement and things like that. But if you're talking about grip strength, right, and you're talking about, activating 6, 7, 8, 9, 6, 7, 8, and T1, then what you're doing is you're activating your autonomic nervous system. So grip strength has been really good for cardiovascular issues, especially blood pressure. And it's been also for cognitive. So if you do a grip and you hold it and you got to maintain it, then you are really kind of using your brain as a control mechanism for that, right? Mm-hmm. And it also, when we look at the cervical spine, we look at the stellate ganglion. And I don't think we talk about the stellate ganglion as much as we should, the superior, middle, and inferior stellate ganglion for heart function, lung function, accessory nerve, right, for trap and SCM function. And then we have the phrenic nerve, right, which is kind of complicated from the medulla out through the cervical spine. It's not really the conventional idea of segmental control with that. So, there are things that, I think about it every day with like some of my autonomic nervous system, but neck movement and vestibular aspects are very, very, very well defined, and we know how important they are. So, I love the neck. I love the lower cranial nerves. And sometimes we get stuck on like the vagus nerve. Like the vagus nerve, if you have an autonomic problem, stimulate the vagus nerve. Well, if your blood pressure is like, 90/60, right? You don't want to be overstimulating your vagus nerve. You really want to get your sympathetic system, really boosted and functioning better. So that's that cool thing about that.
And one of the points I didn't complete is I got kind of distracted in my own brain. But so grip is the last thing to go in the body. And then you look at all the health parameters just in PubMed, there's like over 40,000 papers just on grip. And basically they all come down to the same thing. The person with the strongest grip lives the longest, but it's really about that neuromechanobiology. So for years, I used to say the legs were the first thing to go because dealing with athletes so much, and anybody will tell you whether you're a boxer or a basketball player at NFL, like everybody's like, one day just my legs just weren't where they were and I was no longer a pro athlete, However, that is not true. The legs are not the first thing to go. The vestibular system is the first thing to go. And it's not just because of injury and trauma, but other than if you are the elite of the elite, if you are the gymnast, if you are the cliff high diver, if you are the figure skater, if you're the parkour person, like you are thousands of percents below what your vestibular system is capable of doing. And I see this, I'm a real big advocate of don't wait for problems to occur. So when you see, number one, just simple things, keep it simple and clinic helps out. But how weak people's grip is when they're not even sick, it's like their clock is ticking faster. It just is. Neuromechanobiology it's a big deal. And it is remarkable, when you're a little kid, most kids, you like to have, you laugh, you giggle, you spin around and you get dizzy and you fall over and you're laughing. And even if you weren't an athlete, like those kids just never quite develop as much, and team sports might not be your thing, but you always want to encourage activity in little kids because of the neural development. This will even take us way back into the womb here pretty soon if I don't get distracted. So even for healthy people, it is incredible the value, and they've known this forever in gymnastics and ballet and figure skating before spinners existed in those sports, that, kids that just do tumbling, and even, you could take kids with learning disabilities and put them into basic gymnastics classes or tumbling classes. And there again, they would see cognitive behavioral improvements in these things. But now with the controlled spinning, and you don't have to have the space in your clinic to do those things. And what we just see, there's always been elite figure skaters, but in today's day and age, Bronson was the one that created that impact from general introduction to the elite world-class Olympic level. Everybody uses them, and you couldn't even compete in that sport at all without having a spinner. That's how profound it is. But it will have that same type of effect, whether you're using spinners for cognitive superiority, if you're using spinners to control emotions and anxiety or just be calm. Like, the thresholds and the system benefits are profound. And then, we can not only spin in a chair, which has a lot of value to it, but you can spin standing with or without a balance bar. And, so if they got, I wouldn't get too off topic, but they came out with a sports spinner now as well. Like, they've always had the figure skating one, but they will not sell unless you're a figure skater and you can prove it. Like, you can be an intro figure skater, but you have to have a known figure skating coach. And that's a very niche sport, because these things are like human tornadoes. So they just don't want the liability. They will absolutely not sell a figure skater spinner to anybody. And that even includes me, which was really upsetting when I first met him because these other spinners weren't ready to go. And it's like, look, I came to you guys because I saw what this could do for me and for my clinic. And they're like, no, we don't sell those to anybody. So I had to wait. It's been a great relationship. But so now even the sports spinner, it's the exact one that you have, and a balance bar can go on it. It does spin faster, but then just in seconds, you can put a wobble top on it. And then you also can put an instability ball, we call it, even though it's off brand of a Bosu ball. And then you can put the Bosu ball on top the wobble platform. So, as advanced as you want to go as an athlete, and then it's so different. Like, I have pretty strong feet from all the slack block and calf master work I've done, and, just different aspects, because as a strength coach, I always believed hands and feet are point of contact. Everything else in between is super important. But even by spinning on feet, like, I'm no figure skater and a long ways away from that, but it's amazing when you just kneel on these things then, how different that is. So you don't get the benefit of the neurology from your toes and your feet. That for me is not the weakest link in my body. But when I took that out, and so I'm still in gravity, it was a little humbling just being on my knees and spinning, and I'm like, wow, I am profoundly terrible at this. So just simple, subtle things, there's so much you can do in the chair. I can see where just a ton of clinics are going to have the chair, and in a very near future, we already have the prototypes. I haven't seen them yet, but hopefully in a couple weeks, a month, we do have the laser attach, so the flex stand attachments to go on the spinner chair. So you can be using Erchonia handheld lasers, you can clip in, and you can move them in a variety of different places. So you will be able to spin, do multitasking while you're lasering the person while they're spinning. Right now we spin people, laser them in between spinning sets for the most part. But all those things are happening, but until you really start spinning people and you start testing the vestibular system, you will be so amazed. Like, you work on a lot of sick people, and obviously you're so amazing at it, how people come from all over the world because there's not that many of you. But even when you're working on healthy people and you want a very preventative, proactive chiropractic health practice, you will be mortified how bad people's vestibular systems are in some cases. They may pass some of the clinical things, but you put them on a spinner and it is so profound, in my opinion, in terms of
how quick the changes are.
How quick the changes are. But if you don't make those changes, how down-regulated and susceptible your body is. You are a fragile person, even when you're not quote unquote diagnostic frailty. Like, you can be an incredible fragile person at age 20, especially if you just never were that active kid. You just never developed it to a certain threshold. And some people just aren't great athletes, but like, spinning is, you don't even have to be an athlete to be a spitter. Like, just having a spitter would take any kid that just would say, I'm not athletic, I don't like sports. Spinning can still be kind of fun, and there's just huge benefits. Whether the person is musical, whether they're academic, not completely physical, but when you really look into the vestibular system, it has such a profound impact on those things.
Performance is important to us, whether it's low performance to high performance. So I really like to develop part of my practice around that. It doesn't seem it's going that way, though.
You made quite a name for yourself with people who cannot get help anywhere else. And obviously have people come from all over the world for you and spend some significant time because you are their last hope. But most people wish they could have found you first, and the solutions you provide for people are very profound.
I really appreciate that. I sometimes tell people that, to get the center that I have, you have to have a stroke, and then you have to have a wife that really, really supports your rehabilitation. She's definitely a gem. And so her idea was to buy the Neuroline that we have, the chair that we have, and the specificity that we get with it is, and the data is remarkable.
So let's talk about this a little bit, because like I said, one of the things was when I started making spinners available to chiropractors, you were in the back of my mind because we had met years earlier, and I'm like, oh my gosh, I wish Dr. Joe Schneider would buy one of these. And very shortly, the first email or second email that we sent out, explain we had those, boom, you bought the chair and the balance bar. But, me knowing again how advanced your practice was and the advanced technology that you have had. So let's do kind of, like you talked about the gyro stim in detail. You also have clinical diagnostic things that are profound, but let's also now talk about this chair and even some of the VR things that you're doing, and still, the importance of, bringing lasers into what you do with these amazing technologies, diagnostics and treatment that you use, as well as this new chair that you got here recently too. But it's some of that stuff may be too big a jump for a lot of chiropractors, but that's the other thing I'm excited about, that these spinners are good enough, a little different spinner, but the exact same type of base model and activities to get going to make world-class Olympic athletes that use these spinners. But you're at a whole different deal from a clinical standpoint, but yet kind of the cost-effective, simple Bronson spinners, which there's hundreds of things you can do with each one, it still fits really great into this very advanced neuroclinical practice you have.
Well, it gets there because vestibularly, there's a piece of the puzzle that you don't understand. So for stroke cases, I just talked to a woman, a stroke. We tested her and did a small treatment on her, and I was supposed to report of findings today. She called me up earlier because she had to go out with her husband somewhere, and she's like, well, I've had really good days since I was last seeing you, right? And it was like, okay, what kind of? She moves better. She said, I'm moving better, right? From a stroke, and having her on spinners and doing different things with her, using lasers. I mean, I have Erchonia lasers throughout the office, and she felt immediately better. And then I have a case of a trauma case. So when you get trauma in your brainstem, your subcortex, your cortex, and there's complicated systems that you have to repair. Like I said before, with diagnostics, we want to get very specific about the areas that are really weak. So what the chair enabled us to do was do the semicircular canals horizontally, and then you can put them out. You get them in what's called the right anterior, left posterior matching.
And say the name of this chair again, because the bronze.
It's called Sprycen. Sprycen USA, but Sprycen.com is the website that you can go to. It used to be called Neuroline AI because there is a artificial intelligence component to it. But the data that you get is to put you in space in different positions, so those semicircular canals that everybody's familiar with and the crystals and so forth can be aligned, and then you can find out, like, what's the gain, what's the asymmetry, what's this, what's that. And then there's routines that you can do to see that if you can change the data. And then you can retest and then see if you change the data.
Yeah.
So it's a real time type of test, treat, test, that you can see profound data that's happening with a system that's been gorked from the start. So the first thing, we had a patient that we put on, and then she's been saying, my balance is better, I walk better, and things like that. So we saw the matching canals that weren't functioning right, and we went right to them, did the treatment, and then all of a sudden she says, oh, this is straight. I thought this was straight, right? That kind of thing. So we're getting some really, really great changes with it. We have a kid that walks on his toes. He's like 14 years old. He walks on his toes. And now when he stands up, right, he's flat on his feet. Mm-hmm. So we did him today again, and he's standing up straight, flat on his feet. And, like different things like that is happening with this chair. So it's an alignment of the semicircular canals. And we're looking at different balance issues in different parts of space and time. And then we can look at spinning and map the nystagmus with it. It's called the step maneuver. So you start them with spinning, and then they get an immediate nystagmus, and it goes away. You're looking at vestibular storage or velocity storage. And then you can see velocity integration. So it can get really kind of technical, but it simply is that there should be a normal response of the vestibular system. How far away from it are you? If standard care has not gotten you there, then we need to deep dive and then get you there. We're really excited. We've had it for 2 weeks, and it's really made a significant impact in our practice.
Yeah, that's an amazing statement for you to say, because you've already done a lot of advanced diagnostics with technology as well as academic and skill level, and of course the vestibular spinning that you have had even before it. So it's fascinating to hear how that has taken this huge plethora of information and solutions that you already have, and that information's almost collecting and making it all filtered and easier per case.
Well, doctor, you have about 50,000 degrees because you weren't afraid to go a step further and put people on a spinner, evaluate them, multitask the exercise with it. So there's nowhere you can get the education than we can in our clinics.
Yeah.
You mean it's a learning experience every day, and I can't take a course anywhere that would replace it. Okay. So,
yeah, that's one of the reasons why we've talked about this in the past. And so I'm throwing it out there, like next year for sure. And again, it would have to be in your office. I know we talked about it and things can change. So just in case that doesn't work, but would you still be interested in having a seminar in your office?
Yeah.
We're going to have to cap
break out and learn from all the practitioners there.
Yeah.
They'll probably have their own ideas on how to do it. And then you say, oh, yeah.
But there's a high likelihood.
It might be better.
Yeah, but there's a high likelihood nobody has the equipment that you have in one place. So like how many doctors would be able to fit comfortably in your space? And it's kind of a hands-on, we start with exams and then we kind of go through and use some of the treatment aspects. So how many
We're thinking about 20 docs.
Okay.
Yeah.
So I think that would fill up so fast. This would be a national seminar. And then specifically, you're in what town in Pennsylvania?
It's called Chadds Ford,
Yeah.
CHADDS, second word, FORD, Pennsylvania.
So this would definitely be worth flying out from California and Washington. And
we're about 20 minutes from the airport. We're not that far.
Yeah.
A lot of good hotels in the region and things like that. But no. Yeah, it would be fun, actually.
It would be absolutely great. And I know that just didn't work
Professional
out.
interaction is another scale of education, for sure. Yeah.
Well, we are going to make that happen. And I know just the people listening to this and the email list I've had from all the years of getting out there, I don't think that will be hard. It will be life-changing, whether some people need it for their own health and well-being to make that jump forward, or again, where they want to take their practice. It would be invaluable to be able to, learn in that type of setting. So people, it's not much of a trial and error. It would be an incredible organized flooding of information. People might leave, again, you want that, their own ideas. I would have start here with this. I would have start here with that. But
yeah, exactly.
You would have one of the most unique clinics. And I could honestly say it would be the most unique seminar. And I've done a lot of great ones. I've had a lot of great people there. But
well, you know what? When I had my stroke, you walked over to me and you put a gripper capped in the crunch of my hand.
Yeah.
I was like, what are you doing this for?
Yeah. And now look at you go. And, but it would be so life-changing who gets to go to your seminar. And so, not for selfish purposes, but I want to have it just because I've never got to go to a seminar of what we're talking about. And we will make that happen. Okay.
Sounds great. And I really appreciate you, Doc. You're just a very fine professional, good man, and it's nice to have you as a colleague.
Well, it goes both ways. It's truly amazing what you've been through yourself and what you're doing to help other people, and you're going strong. So it's a testament as well that even when people go through tough times and they might question where they're at in their own life and career and profession, but you're a true testament. You walked the talk, to say the least. And you didn't quite refer to it at this time, but before we close, I know you shared the story about you with the stroke before, and even when you were in the bed and pretty incapacitated. And knowing life was very changed for you already. I don't know if you had lost your 2 clinics when you were still pretty bedridden, but you got your big inspiration while you were lying there, and you were pretty incapacitated when you first told your wife about the brain center concept.
Oh, yeah. She didn't believe me. She was like, okay, I don't think a Hope Center is going to happen, so it's not going to happen. It was really important that she was standing by me through the whole thing. And really one of the most important relationships that I've ever had in my life. And then, I did have a near-death experience. So I know there's a God. And before, I thought I knew, but I really didn't know.
Right.
And so, we have a faith center. So our center is faith-filled. It's Christ-centered. Our staff prays in the morning. My wife and I pray intensely every day when we get up, and we don't leave the house until we've finished all our prayers and reading the Bible and things like that. And so, purpose changes. A lot of times in life, you're like trying to get money and have, more things and so forth and so on. But, our purpose is helping people and giving all the glory to Jesus Christ. And so that's like extremely important to us. And And like really, when you make a life impact and you change a person's life, it is truly a life impact, but it's also a spiritual impact also, right?
Yeah.
And we talk about fitness. There's spiritual fitness as well as emotional fitness and as well as body fitness.
Mm-hmm.
And it's whatever you focus on, I believe, and if you're God-centered, it'll happen for you.
Well, you had a spiritual enlightenment or a spiritual inspiration, while you were incapacitated. Some people would look at that and say you kind of self-inspired yourself. You had this vision, but I'm glad you shared all that. But just because of that experience, but I also know when you had that spiritual inspiration to make this hope center and you're like, what are you talking about? Like, you can't even poop and pee by yourself right now, but yet it was so real to you. Like you just knew. And I know when people walk into your clinic and they've just had nothing but failures up to that, nothing but disappointment. I mean, it is doom and gloom, but also though, when they walk into your clinic, like how many times you give that person that pitter patter, and whether it's the data that does it or you flick those upregulation switches, but it's so profound to tell people and you set goals for them. Like you had a goal when you were in bed, a goal that helped you recover even more. And I think it is so important to give people that come to us something tangible, especially when we can measure it. And the technology is great, but there's a lot of things we can do that you don't have to have all the technology that you have, but stair step into it. But I think that is such an important part as well. And even people don't have to go through your experience to have that kind of touch with reality. But I think in all of our cases, whether you're doing vestibular spinning or not, when you give people a goal, especially, that's what I always loved about being a strength coach. I kind of bring that attitude into the clinic setting, where people think they're here. And it's like, oh no, I promise you, you can get here. Now, here is still a far away from your potential. But every other doctor tells them, oh, don't do that, you're going to hurt yourself. And I'm like, well, if you're going to hurt yourself doing that, then we're going to train to where you don't hurt yourself doing that. I mean, that's not even an option.
Yeah, getting some of the patients to train.
Yeah.
Like I have a woman with Parkinson's, and she's a really beautiful person, and her husband are a great couple. And so I've been telling her, like, you got to get on that treadmill, 5 minutes, 10 minutes. So we just put her in the new chair by Sprayson, and she got off it, and she's walking better, like almost immediately walking better. And then when I got on the phone to do the report of findings, it was actually a video call. And I said, all right, you can't come back for any more treatment unless you're on the treadmill every day. And if your husband gives me that look, like,
yeah, I love it,
then you're done. You're done. Yeah. And she says, well, how about if I go on it 30 minutes every day? Would you be happy then? I'm like, okay, yeah, I will be.
Yeah.
That's super. So motivating our patients to really have compliance with exercise and really taking responsibility, like you said, for where they want to go. Like, what is your goal, right?
Yeah.
It's not my goal unless it's yours, right? Then it's not going to happen. It's not going to happen at all. So,
yeah,
that's
it's
really
amazing.
Part of it.
I know you've made my life better knowing you, and you set a standard that, like I said, keeps me in check for sure. That's an understatement. So this has been great. Thanks for your time, Dr. Joe.
It's always a pleasure, Doc.
Yeah, I'm sure we'll do another one sometime too. We'll do a spin-off of this, but thanks. And everybody who's watching this, we look forward to communicating with you as well and helping you find your next step in life purpose. Thank you for listening to the Brain Body Fit podcast, where we are dedicated to helping doctors and clients integrate clinical evaluation and performance enhancement. Please like and share this episode with someone who wants to empower their own health and actively participate in the health revolution of the growing millions. Epic changes are real. Visit us at performancepractic.com, where you can explore premium selected products and services that we have used to change the lives of thousands in our clinic and seminars for decades. Follow us on our socials. All the links are listed in the podcast description. If you are interested in personalized health programs and want to work directly with Dr. Jerome Rerucha, schedule a paid consultation to apply for starting a 3-month professional supervised healthy eating program. Also available are individual comprehensive restorative care program options with additional lab testing and services. Head over to performancepractic.com or simply click the link in the description to learn more and apply.